Also from the Mayo Clinic, please welcome Travis Wilson.
As a leadership coach, I love questions, currently. I'm also the father of a 2-year-old, and I've come to learn that 2-year-olds also love questions as well, particularly one question that is asked repeatedly. Will my love of questions outlast his love of questions? We'll see. But for right now, I love questions because, like signs on the road, questions are guides, giving information and placing us in interesting places. And today what I want to do is talk to you about what I call courageous questions and what they can do for healthcare leadership. A courageous question is a question that challenges conventional thinking. In the mid-1800s, Ignaz Semmelweis asked a courageous question. Could physician negligence be killing hundreds of patients at my facility? And he was right, because doctors were delivering babies after handling cadavers and not washing their hands properly. Now, this notion back then was crazy. It was unfathomable. Physicians killing, I mean, that was crazy back then, which made his question precarious. But he chose to swim with the sharks, to jump in, and to ask it anyway, and risk being gobbled up. Why? One question. Well, the reason why is because, like exposing long-term human suffering, it was a topic that was uncomfortable. Courageous questions are uncomfortable for the person asking and for the person receiving, because questions require answers, and answers highlight agenda. If you were to question a king back in the day, you'd get your head cut off. Very clear what the agenda was with that king. And it was very clear what the agenda was in the mid-1800s medical establishment. Thanks, Ignaz, but your data is good, but it doesn't match what we believe in. It doesn't fit our culture. And then you're left ostracized and alone. Courageous questions are the questions we need to ask, but we are afraid. We are afraid to ask and afraid to receive. And healthcare is filled with these questions. And some of you out in the audience may be experiencing or have experienced what Semmelweis did. But what do we do? I'd like you to consider this. What if we in healthcare were to change our mindsets around what these kinds of questions are? I think if we did, what was familiar to us and known to us is something that we can transform into something different and more powerful and more vulnerable. We can make courageous questions our barometer for leadership. If you're feeling scared about asking a question, then that is the question to ask. And courageous questions right now around the right to die, avoidable harm, cost transparency have created communities. We can transform our agenda, because if a king can say, off with your head if you question me, the king can also say, if you don't question me, off with your head. Leaders can then get out of their way and ask themselves powerful questions like, how am I getting in the way of the important work that needs to be done? We can talk about the situations that we are uncomfortable with. The taboo topics are now back on the table. Topics such as workload in academic medical centers. Topics like the efficacy of maintenance of certification exams, administrative bloat, ineffective leadership development. And then what we can do is we can eliminate the cynicism and the mistrust that keeps us from sharing our ideas. Instead of, we didn't hear about that, we transform into, hey, we didn't hear about that. And we no longer see each other as predators, but as valuable aspects of the healthcare ecosystem. We can also embrace the devil's advocates. Ignaz Semmelweis, he never lived to see the impact of his work, even though his data was spot on, and countless lives could have been saved. The establishment wouldn't let him. We are the establishment, and we are Semmelweis. We don't choose the signs that we put on the road, but we choose the questions we ask, and we choose who we are when those questions are asked of us. So when it comes to leadership in healthcare, be very mindful of these particular questions. So I have a choice. Who am I when this brave soul asks me his courageous questions? Friends, I don't know what the answers are for healthcare, but I know what the questions are, and so do you. Ask.